no, very different normal for folks. And I've found as a heart surgeon that it's useful to talk to people because uh, some folks have used this as an opportunity to get in shape or hit reset on their life and prioritize exercise, while others have sort of taken a different pathway, and that pathway has not necessarily resulted in the best life choices. So the consequence of that for me as a surgeon is that the folks who are coming into the operating room now tend to be quite sick. And what I mean by that is that there are external factors that prevent us sometimes from making poor choices. For instance, those who smoke, they can't necessarily smoke in their jobs or in public places or around schools or parks or things. So that is an external limitation of tobacco intake. Well, now you're at home and that external stopgap doesn't exist and we're left to our own devices. And so the people who smoke, we're finding are smoking double, triple to what they did before. So instead of half a pack a day that they smoked half of and with cigarette breaks, they're now smoking 2 packs a day, lighting one cigarette off the other, or they're vaping. And these things have dramatic consequences with COVID infection, especially vaping, which I'll get to a little later. But in addition to smoking, we're finding more poor choices in food. Folks who are used to eating out a few days a week are now faced with cooking for families or eating every meal at home. And A, that gets expensive, and B, the choices that one makes aren't necessarily the ones that we would make when we were out in front of other people. And there's a lot of stress eating. So there are many folks who are gaining weight because of poor food choices and lack of availability of good cuts of meat. We go to the supermarket now and you see the aisles full of pretzels and potato chips seem barren, but there's plenty of produce and plenty of of fruits that are available because we're stress eating and we're trying to fill that void in ourselves with food in some cases. And then moving along, alcohol intake has gone up. I think it's 163% year to date. And it's because, again, we're not at work. So we're working from home, we're working from screens, and we can hide that. And so 5 o'clock comes a bit earlier now because we're, again, dealing with stress. So the daily alcohol intake has gone up. So when I'm seeing folks in the operating room, I'm seeing people that smoke heavily, are gaining weight. Their livers are congested from months of now severe alcohol abuse, and it doesn't necessarily need to be that way. And obviously, this is a stressful time, no matter what you do for a living or who you are. But it's important to, at some point, make a decision. And I read an interesting quote the other day from Denzel Washington. He said, well, for all those people who were upset because you didn't get in shape or learn a language during quarantine, the good news is it's not over. Get back inside and start. And it's a true statement that we are not going to necessarily go back to life as we knew it before anytime soon. So we have the ability to look at today as our day on the calendar of hitting reset and making life choices that can A, protect us from the ill effects of getting COVID, and B, making us healthier candidates for the illnesses that we may have or may be able to present. And that's really the intention of this conversation. And to say, well, what are the steps that I can take? And the first step is structure. Uh, we don't have any structure in our lives right now. So if you're not working every day or you're not dropping your kids off into a defined place, you're now into a world that doesn't make a lot of sense. You're getting up at an ill-defined hour of the day, maybe having a Zoom call, maybe not, or now trying to figure out, well, how am I going to plan my day and where do I prioritize food choices and exercise? And the first is that if we're at home every day, there should be an opportunity to exercise. And exercise uh, doesn't mean uh, 10, 15 minutes of doing a few sit-ups or jumping jacks. It's defined exercise for a half hour, 40 minutes of heart elevating exercise at least 4 times a week. And it's important to find that time to do that. And the easiest way to do it is to just get up a half hour earlier in your day, because you say, well, my day is packed and I don't have the time to exercise. We always make that time once we have an adverse event in our heart. We always find that time to prioritize our health once it's too late. So if we got up a half hour earlier and use that 30 minutes to exercise, it's a good start. People say, well, what type of exercise do I do? And it's really matters most. I tell folks that the most important piece of or frill or bell or whistle on a piece of exercise equipment is the on off switch. It's whatever you're going to turn on a few times a week. And the beauty now in this quarantine is that almost every fitness center has some sort of online streaming app, whether it's a few dollars a month or whether it's free. It doesn't much matter what you choose as long as it's going to be something that's going to captivate your attention. Uh, Everything from yoga to Pilates to Zumba. I do something called 54D, which is a high intensity interval training class 6 days a week for an hour a day, and it's free. It's normally several $1,000s for the 3 month class, but this has been free for the last 14 weeks and it streams live. And so there are many classes like that that will offer it. And it's just a matter of experimenting or Googling, what is the different types of either bar exercises, Pilates, some sort of fitness thing, and then doing it and committing that you're going to do it. And you want to have something that's going to be seamless, that you just need to get a bottle of water and a pair of sneakers and turn it on and turn on your phone and reliably do that every day. So that will give you the at least the impetus to start. And then it's great to get a couple of your friends doing it at the same time, so there's accountability. And you could start doing it together, because the people who have used this time have really gotten in dramatically better shape because you can. You now have that big burden of being at an office or at work, and now that's gone to some degree. And if the class is free, you get on it and you start, and one day at a time, you start taking that weight off. It takes many years to put weight on, so it takes a period of time to get it off. You can't get it all off in just a couple of week period, but new life choices can help you do that. And why is that important? It's important not just for getting that belly weight off of you, but you feel better, you get more optimism, and you'll be a healthier candidate to deal with the consequences of an infection if one comes your way. One of the things that we talk about a lot in heart surgery now, or in cardiology or heart health, if you will, is this concept of metabolic syndrome. And what is that? It's that apple type of appearance where you've got the skinny little legs and skinny little arms, but there's big weight around your center. And that's what is giving people diabetes in the United States. So 33% of our population now has glucose intolerance or a propensity for diabetes. And that inflammatory state may also have some relation to how people do with COVID, meaning that this what's called cytokine storm, or this inflammatory response that happens, may be tied to that level of truncal obesity we have. So getting rid of that makes sense before one gets infected, because you may fare better. And what we found, in fact, when we look at folks who have the severe infection with COVID, is that those who are obese have fared less well than those who don't have that. So preparing yourself now for the possibility of an eventual infection down the road makes a bit of sense. So getting that daily exercise and getting that weight down. And it's harder now because, look, we're all stressed out. We don't necessarily know when this pandemic will be over. We don't know if we're getting infected or not. What is the risk factors for having severe disease? When a vaccine's coming out? What's my job situation. So all that stress kind of adds up and produces a hormone in our system called cortisol. And cortisol is important in how we process fat and sugar, and that is what gives us that propensity or to put weight on and hold it, and how we respond to sugar. So based upon our diet choices and our ability to handle stress, that weight will be easier to get on and off. And right now, the impetus or the body is telling us hold the weight on because we don't know where our next meal is coming from or what our future holds. So we're in that stress response, and that's going to make it harder to stay in shape as it is. So you want to combat that by exercise. And exercise has both the effect of burning calories and also changing your mindset on stress. You uh, don't necessarily have the ability to control most of what is happening right now. So there's something that people talk about a lot called the 90-10 rule. You can't control 90% of what's happening, but you control 10. That 10 is really your response to the 90. So by taking that 10% and saying, I'm going to control the things I can. I'm going to control what I put in my mouth, how much exercise I do in a day, and how I respond to the environment. And well, we can change our appearance, our health, and therefore our ability to prevent cardiovascular disease and also respond better to infection if that comes to be the case. So to focus a bit more on exercise, uh, what is our goal in exercising? And so when I say you want your heart to be raised, the simple formula is 220 minus your age. That's your maximal heart rate. So I'm 50 years old, so my maximal heart rate is 170. So in order to exercise efficiently in a way that I'm going to lose weight and create heart fitness, I want to be somewhere between 70 and 90% of my maximal heart rate. So if so it's just simple math. You're multiplying by zero point 0.7 or zero point 0.8, and that's really where you want your range to be. So I want my heart rate to be somewhere between 140 or 150 for 45 minutes, and that will give me weight loss and cardiovascular fitness over time. And if I do that 4 or 5 days a week, having some rest in different days, that's perfect. Now, the next concept that people are bringing up is, well, if I can't exercise at home and I really need that motivation of going to a gym, how do I safely go to a gym? And what's the concept of masks and going to a gym? And you'll see a lot written right now on masks, and people who are very passionate one way or the other way. Some saying, well, there should be no national decree on masks. Some saying that there should. It makes logical sense that if there's a virus that's transmitted through respiratory droplets, that if you have a barrier to their entry, you'll fare better than if you don't. That's just intuitive. And masks, I would agree, don't necessarily protect the wearer of the mask as much as they protect the people around them. And that's why it's a sort of a societal thing that we all should be doing it. And so the concept then comes in being in a gym. Uh, how do you safely wear a mask so that you don't drop dead of a heart attack because your breathing is too restricted? And that becomes a compromise. And the compromise is that if you're going to go to a gym and wear a mask, it would help if everybody wore a mask, because you want to have a barrier to breathing in secretions of your own, and B, the other folks that are surrounding you doing the same, so they're not transmitting it and you're not breathing it. And so that trade-off allows one to have a less restrictive mask. So and what do I mean by restrictive? Restrictive. So this is the mask I wear in an operating room. It's a very impervious temporary paper mask that prevents me from breathing my germs into the wound of a patient that I'm performing heart surgery on. It's not in reverse. So there's nothing about a patient who would have, say, tuberculosis that is going to prevent me from getting it by wearing this mask. This mask is only designed to protect the patient from me. And so, uh, wearing this though in a setting of exercise is not such a great idea for a few reasons. One is that it's made out of paper. So by being made out of paper, over the course of time with sweat and breathing heavy, I'm going to wet this mask. And by wetting it, it's going to fill up all the pores and make the mask A, harder to breathe, and B, less effective because the pores or the channels of the mask are now clogged. So it's not doing its job anymore. Second thing about this is that it being paper, it only lasts for 8 hours. So the people that are wearing these paper masks day in and day out over and over again uh, are not getting the effectiveness of it because it's got a finite lifespan. It fills up with dirt, fills up with bacteria, and now it's sort of a cesspool over the course of time. So this is one I just wore in surgery today, so to use as an example, but at the end of the day, this will go in the garbage because otherwise it doesn't have effectiveness and actually can do more of a disservice than good because it's just a little repository for disease that's sitting there. Along those lines, taking these masks on and off makes a difference because if you take it off from the front after you've worn it all day, you've now put all that disease that is trapped in the front of the mask on your hands. And then what's the first thing we do? We take our mask off, we text, and without washing our hands ahead of time. So it's important to pay attention to that, but that's a bit off topic. So in dealing with your exercise, a fabric mask is really the way to go. And so this is one I kind of like. It's from Under Armour. It's on back order right now, but I tried a bunch of them. And the thing is, you want the mask to be off your face, meaning, so you want this little point over here. So it's not directly on your nose or your mouth. It's got a space in between. So when it gets wet, when you're exercising and panting. So if you're really exercising to your maximum heart rate, you're breathing at 40 breaths a minute or so, and you're taking big breaths, and those breaths are humidified because you're trying to bring your body temperature down and by expelling out moisture. And so in this world of COVID, we want to prevent all that moisture from getting trapped right smack in the front of your face, which is going to make the mask wet and again, not effective. And B, you want to be able to wear it for your whole exercise session without it being uncomfortable and without breaking out and it becoming heavy and onerous. So a fabric mask that has like a quick cool mechanism, something that's going to get rid of the moisture quickly. There's a bunch out there. There's another one I found on Amazon that's available. It's got these little vents in it, which is kind of nice. But what you don't want to do is start wearing an N95 mask because what that's going to do is restrict your breathing too much. So when you start to get a high heart rate, your amount of oxygen in your blood is going to drop. And when that drops, if you don't have the ability to bring it more in by taking bigger, faster breaths, it's going to create a deficit in your body of what your body needs versus what it's getting. And the consequence of that is can be injurious to a person, or you're going to end up with a heart attack if you have pre-existing coronary disease. So when we're wearing masks and we're thinking about going to gyms and exercising, it is important to give your cardiologist a call if you're being treated and saying, hey, can I exercise in a mask? Is it safe for me? And what level of exercise can I do? They may advise you that it's completely fine, but it's worth checking with your doctor ahead of time before jumping on your exercise device. And along those lines, if you're someone that's exercised all of your life and you have a baseline, that baseline isn't the same when you're wearing a mask. It's sort of like if you're used to climbing rocks in Miami, or climbing up a small hill or up the Rickenbacker Expressway. That's not the same thing as climbing Everest because your oxygen amount is different, and that's why you have to acclimatize. So if you're someone who is even used to cycling, which is very popular in Miami, or running, or running on a treadmill, it's important not to think you're going to achieve your same pace by wearing a mask, because again, that restriction that exists on your breathing is going to decrease your pace a little bit. So it's much better that if you're running an 8-minute mile, to say, well, I'm going to start with a 12-minute mile and see how I do, and I can gradually pick up my pace. because you're doing the same level of exertion on your heart with a different speed because you're restricting your airflow. So uh, as far as masks are concerned, I think that uh, it should be a group decision when you're going to a gym. See what your gym's feeling is on it. When masks are being worn, it should be something that is fabric and not as restrictive as an N95. If you're working out by yourself, you can make those decisions on whether to mask or not. One of the rules of thumb, if you're exercising outside, is that the social distancing concept of 6 feet, that's social distancing when you're sitting at a table having a cocktail or a meal. It's not when you're exercising. So the rule of thumb is that if you are walking, it's 6 feet, if you're running, it's 12, and if you're cycling, it's 24, uh, is what your distance from the next person should be because of your closing speed on the person in front of you. So if you're running, it would make more sense that 6 feet of distance isn't enough because you're panting, spraying your moisture about, and you're going to close on the next person in front of you much quicker. So keep that rule of thumb in mind. So to move on from exercise and wearing of masks, then when we go into food choices in COVID, and there's a reasonable amount of information now that's suggestive that uh, those who have severe disease are deficient in vitamin C and vitamin D. Now, whether that has happened before they got COVID or whether or not it happens um, in the course of the disease and it's being consumed by this severe, what's called cytokine storm, not really known. But what is known is that repleting those are a very low cost and low consequence of having more of it in your system. So vitamin C, citrus fruits, or vitamin C tablets, it's far better to get it naturally from a nice glass of freshly squeezed orange juice. And vitamin D, we have plenty of that in Miami, just going out in the sun for a half hour uh, and repleting your vitamin D. It's a great source and also brings a bit more optimism to sit inside of your dark apartments or homes. Is more depressing, at least getting out and letting the sunshine for a brief period of time, and that'll help your vitamin C and vitamin D. In addition to that, high protein diet is important. Protein is consumed during any healing process and any illness. So you may notice if you've had a fever or a virus in the past for a week or so, your clothes are ill-fitting. Mainly your pants are loose in the legs, or your shirts are not fitting well in the back. And it's because that's where your largest source of energy is, your skeletal muscle. When you're healing from an illness, your body sends out a signal, and that signal is, hey, we need more energy. And the place where blood most readily is intercepted is in the muscle, because that's what you need to move, right? So your arteries are in constant contact with your skeletal muscle, and so the protein is what's absorbed first. Fat, unfortunately, is last because it doesn't get that signal, because fat's not natural in the body. So when the fat accumulates, you don't get the same arterial network into the fat as you do the muscle. So muscle responds to the call quicker, and so muscle is what is consumed when your body's trying to heal. So you want to, in advance of that, keep your protein stores high. That's important both before you're sick, during the course of your illness, even when you don't have an appetite, to make sure you're having protein shakes or repleting your protein with Ensure. And then when you're, most importantly, when you're coming out the other side of the disease, whether that is surgery or whether that's COVID, while you're healing, high protein is critically important in order to facilitate your healing. So between vitamin C, vitamin D, protein, um, the next is just to avoid the processed sugar. Much in the world of heart surgery has been focused on fats and how horrible saturated fats are. The reality is, what we're learning is that fat may have had its contribution in coronary artery disease, but the likelihood is that the whole process starts from processed sugar and this inflammatory syndrome. So you want to keep your processed sugar to a minimum, lower that poor quality comfort food. I mean, not to say you can't have your cheat days or your snacks, uh, but to lower that to the extent it's possible, because that will prevent this inflammatory system, prevent insulin resistance, and promote a more healthy body going into either an infection, going into surgery, or just living your life. You'll feel better if you can get yourself off carbohydrates. And then the lifestyle choices, which are difficult. And look, no one is saying it's easy to quit smoking in a time of horrific stress and uncertainty like we have right now. But arguably, the most important and best decision that you could make for your quality and quantity of life is to stop smoking. And stop smoking means stop smoking everything. And whether it's cigarettes, cigars, vaping, marijuana, it's more the mechanism of getting into your system than it is actually what it is you're having. So tobacco, well known for its contribution to lung cancer, also for coronary artery disease and vascular disease. It's nasty, and there's no therapeutic benefit. It doesn't make you feel any better. It costs a lot of money. Nobody has any money anymore because everyone's, has this uncertainty with their jobs. So spending extra money to smoke doesn't make a whole lot of sense anymore. So quitting smoking, I think, is really the most important health decision one can make. And along those lines, vaping to why we're seeing in Miami right now the influx of young patients that are getting mild to moderate disease symptoms with COVID. We're finding a good number of these folks vape, and they're creating this acute lung injury, and that lung injury then worsens the effect of being infected with COVID. So for your kids, for yourself, if you vape, vaping is something that, at least until this pandemic is over, one should avoid. It's again, no upside to it at all. And uh, there's this really ill effects acutely on COVID and on general health. Even before COVID became a thing, we were finding that vaping was creating this acute lung injury and almost the same type of syndrome on young patients that we're seeing now with the cytokine storm and horrendous reactions. And then finally, as far as lifestyle choices, um, I'm certainly not going to criticize anyone for drinking alcohol, but we need to have some sort of external stopgap. Many folks uh, don't have a rheostat. They have an on-off switch, and when you turn that switch on, it doesn't go off until either you run out or pass out, and that's not really a great way to be right now. We find that we are drinking much more as a population during COVID, and that does lower your immunity and the ability to fight infection, and also puts certainly is a huge source of carbohydrates and weight gain, because not only that bottle of wine that you drink and how many calories are in a bottle of rosé, but then all the crap that you eat after you've had a bottle of rosé, because it's like a great time to have fries or chips or and then go to bed, and all that food gets stored because your body has to burn off the alcohol. So it's a matter of saying, well, I know we've got to deal with stress somehow. Dealing with exercise or intimacy with your partner, probably a better choice than drinking all day. But it's a matter of keeping some sort of checkpoint on yourself and saying, well, I'm going to limit it during this period of time, because it is a stressful period and it's hard to make all of these life changes. But certainly it's going to give your body a host of benefits. So that was a lot to absorb, I think, in a half hour. I used 30 minutes sort of as a stopping point so that I can address any questions that may come from the audience. So maybe I can pause and see if there's anything that people want to ask from the group.
I'd like to ask a question, if I may. Can you hear me?
Sure. Yeah.
Okay. I'm not saying it was me in particular, but if you were somebody who was drinking a lot of alcohol during this time period, I'm Irish, so if I have an excuse if I did, is there anything you can do to improve your liver health?
That's a great question. So there's a couple of things that are consumed um, by drinking a lot. One is magnesium, and the other is zinc. Uh, there's there is a multivitamin, and B vitamins are get deficient too, because when your body processes alcohol, it needs to burn it, right? And burning everything requires some extra stuff, and the extra stuff that your body uses are magnesium, zinc, and B vitamins. There's a multivitamin called Drinkwell. I have no financial interest in the company, but there's these 3 multivitamins that you take. You're supposed to take it before you do start, having a couple of drinks, and it's full of it's full of zinc, magnesium, and B vitamins, and that's purported to help not only with the hangover but also with processing alcohol. But there's selenium is the other thing that is supposed to help liver regeneration if you do tend to have a lot to drink, and it's your liver will regenerate itself. It's just a matter of taking a break from time to time, and that's why people talk about dry January. That month, there's a massive change in the composition of your liver and the removal of fat during that 1 month period that people are studied predominantly in the UK. I'm Scottish, so I appreciate the Irish comment as well. It is so you do want to make sure that you don't shirk your nutrition during a period of time of heavy boozing. B vitamins, magnesium, and zinc are the things that I would recommend increasing for that period.
Thank you very much. And I wanted to make one comment about the mask wearing and exercise. I'm not a runner, but I have severe asthma. And I have found that wearing a mask has actually improved my lung function from walking, wearing a mask. It just seems, I guess, because I have to breathe harder.
Well, no, I think there's 2 reasons for that. One is that, yes, if you're breathing harder, you're going to recruit more of your lungs. So when we take a normal breath, we're not filling our lungs to capacity. So if you're sitting down now and you're listening and you're taking a normal breath, you're only opening about 30% of your lungs, because you don't need to open more, but you've got all this extra space. So if you take a real big breath and blow out your belly and really move your diaphragm down, like you take just a real big breath in, well, that's gonna really expand your lungs. So if you're working against resistance, you're going to be pulling harder. So yes, you're going to use more of your lung. But more importantly, for those who have allergic asthma, like you may be describing, the mask is going to help filter out allergens. You're going, if you're someone who's allergic to freshly cut grass or pollen, well, it's going to be absorbed in the mask. So you're going to have less of that if you're running outside. So the mask is helpful.
Cool. Thank you very much. And awesome lecture. Thank you very much.
So one of the other things that we're having an interesting conversation about is surgery and elective surgery going on right now with in a era of COVID, and you'll find that there are a variety of places that are shutting down elective surgery because we don't have capacity. And you hear people talk a lot about herd immunity and well, if I'm going to get this one, I just go get it anyway. And it's really a math problem if you think about it. And so I wanted to address why at periods of time hospitals will stop elective surgery and then restart it again. And it's not meant to be mean or punitive. It's just that we have a numbers problem. We have a certain number of people that live in Dade County. And if we're going to expect over the course of time that all of these people are going to get COVID at some point in the absence of a vaccine, well, we don't want them all to get it at once. Because on one hand, most of the people who are getting it are not profoundly ill. And 90% of them, pick a number, are not gravely ill. They feel lousy. They've got a fever. They're hit by a bus. Maybe they're a little short of breath. But the ones that need to go to the hospital are a small percentage of those people. But if that small percentage is a small percentage of 10,000 people, well, that's manageable. If it's a small percentage of 100,000 people, it's less manageable. If it's a percentage of 1,000,000 people, it's not manageable. So this concept of saying, well, let's all just go out and have a COVID party and all get sick, not a really great idea. Because what we do want to do is, if everybody's going to get infected anyway, we want to sort of pull that one out for as long of a period of time, because a couple of things happen. One is that we can allow the sickest people to get care and not run out of beds. Two, have more time for innovation and figure out better treatments for the disease and recognize who's at risk and who isn't. And also hopefully get to a point where there's a readily available vaccine. In the meantime, in Miami right now, you see all the reports of spiking numbers, and the numbers don't necessarily mean that everybody's sick. The numbers mean that people have tested positive. So although we're having tens of thousands of people test positive a day, that doesn't mean they're all sick, all in the hospital. But it does mean that we need to keep room in case we do get a population that is sick and we get overwhelmed. So we do take steps when we hit a certain percentage to say, well, it's not necessary for us to do this purely elective surgery right now. We need to put it off for a bit of time so that we have the resources available for folks if we do get a surge. And so that's why we briefly shut down surgery at different hospitals at different times, so that we can keep those numbers game working and keep available beds. That's not to say that you should not seek care if you need it. So there are people that are saying, well, I don't want to go to the hospital. I don't want to go to the doctor's office because I'm afraid I'm going to go get COVID. And we've taken tremendous amount of steps in our hospitals down here to prevent patients who don't have COVID from getting it. Everyone in the hospital that works in the hospital is wearing a mask the entire time they're in the hospital. We're maintaining social distancing in our office hours, and patients, we're giving people a large amount of topical hand sanitizer, and allowing only a single visitor for people in surgery. So we're taking all the steps necessary. So the likelihood of you getting COVID, and in fact, no one in my surgical practice who has not had COVID has gotten it by coming for elective surgery. So we have managed to mitigate or prevent that from happening. But what we are seeing is that people who are afraid to come to the hospital for fear of getting it are faring much worse. They're having heart attacks at home. They're having gallbladder issues, rupturing their appendix. And they're not coming to the hospital because they're afraid they're going to get COVID. And in fact, what they're happening is that they're dying at home from diseases that are completely preventable because of this irrational fear. And we're finding people that have had massive heart attacks and really impacted their quality of life because of an unjustifiable fear that they were going to get an illness that's largely self-limiting and not necessarily going to cause any destruction to their life at all. But what will is untreated coronary artery disease or untreated valvular disease, where you may feel this terrible shortness of breath or this terrible chest pain and say, well, oh my God, I've got COVID. No, oh my God, you're having a heart attack, and you need to go to the doctor, or you need to go to the hospital, and to stay home and just because of fear that you might get this disease that the world is talking about and vilifying into something that is much more than it is, I think is the wrong approach. So by all means, everyone needs to take precautions. By all means, you want to maintain social distancing, mask, wash your hands. But if you are feeling symptoms of shortness of breath, of chest pain, of dizziness, that you would normally seek medical care for, continue to seek medical care, because that is going to cause a major adverse effect in your life, not a fear of picking up this virus. Any questions about that? Anyone? I don't have a lot of formal discussion left, so I left this last bit of time open for informal back and forth discussion if anyone has anything to talk about.
Mm.
All right, well, I suppose we can end here then. Bianca?
Sorry, I was on mute.
No
I
problem.
was asking about the importance of continuing medical screenings during COVID and the risk factors of men and women, and the importance of continuing.
Continuing what? What screening?
Your just medical screenings, health screenings in general?
Yeah, I think that we certainly want to limit unnecessary trips to the doctor, unnecessary trips out in general during this period of time, especially in Dade County where we're having this surge. But your routine medical visits to make sure you have your daily medicines, your hypertensive medicines, your cholesterol medicines, diabetes medicines. You certainly don't want to run out of those or miss your scheduled appointments with your physician, so that these diseases, chronic diseases, are maintained within levels of normal. Yeah, it's, again, that there's a far greater risk of letting your medical care lapse and not paying attention to your chronic conditions than there is having a fear of going to the doctor's office where you may contract a virus. I think that doctors' offices and hospitals have done an amazing job of preventing transmission. But what will cause an adverse event in your life is allowing your chronic conditions to be untreated.
Thank you, Dr. Stewart.
Can I, yeah, before you close, I wanted to ask a question about the masks. When you were showing the different types of masks, the ones with the valves,
yeah,
they call them, I think, sports masks.
Yeah, this one.
Yeah, and then I read something online, and it has like the filters inside. And then I read because you're spewing germs on other people, and I didn't know if that was actually true, so I hadn't wanted to wear them because of that.
Yeah. So the thing about to just deconstruct this particular mask, and I had this one before I got the the other one. The nice thing about this one is you just throw it in the wash. The downside of it is that it doesn't have the filter. So the valves are necessary so you can change the filter, because otherwise it wouldn't be a great way to change it. Now the thing about this valve is that it's a one-way valve, so it's not going to spew germs on other people. But what you are going to do is capture everything on this filter, and then the filter has only a finite use. The problem is that people don't change the filter. And this is a very, very restrictive filter, so that if you're going to wear this for a period of time, it's going to do its job. And its job is to capture particulate matter, right? Whatever it is, whether it's dirt, pollen, bacteria, and it's all going to be stuck in this thing. And if you wear it for a week and then stick it on your face, I mean, you now have a whole week's worth of bacteria that's sitting in this mask. And no, you may not get COVID, but you may get a terrible sinusitis because you've got all this bacteria that's been festering for a whole week on it. So you want to make sure that that if you're going to wear a mask like this, you can wash the black part, but the white part's got to go in the garbage, and you've got to replace it every day. And it's a matter of being fastidious on that. And what normally people do is they'll put this on and leave it in their car, go to the supermarket, and every day they're putting the same mask on, and a week, 10 days go by, and you're like, geez, I wonder when the last time I changed that white thing is, and you find it's been a while. So that's the downside of this, in my opinion, is just this recognition that you've now got one more job. You've got to clean your mask every day.
If you wear red lipstick under your mask, you know if you've used it and you haven't.
It's a great way. I don't think I'm going to use that one, but but not a bad idea.
Thank you very much.
Well, thank you, Dr. Stewart, for a very informative lecture. I know everyone from the town of Bay Harbor Islands enjoyed listening to you, and will also be able to view the recorded lecture on their YouTube channel.
Great.
Thank you.
Thank you.
Thank
Appreciate
you,
having
Dr.
me.
Stewart. Thank you so much. We really appreciate it.
Thank you.
Take care.
Bye.
Bye-bye.
Bye-bye.
Bye.